We will start with the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the regular trustee meeting, March 22nd, 2022. Minutes of the special finance meeting, March 22nd, 2022. Minutes of the special trustee meeting, April 13th, 2022. And a check report, March 9th, 2022 through April 8th, 2022.
I'll make a motion to approve the consent agenda.
Second.
Sure I did hold true.
Mm-hmm.
I have a motion by Dr. Hannaford, a second by Dr. Simon to approve the consent agenda as it was presented. Roll call vote, please.
Jasper?
Yes.
Hanford?
Yes.
Simon?
Yes.
Brown?
Yes.
Coleman?
We don't have
Yes.
information.
Okay.
I know you want to hear it.
Next item is the CEO's report. Candace.
All right, thank you. So just a few items. The HR, as you know, back at the first of the year, we started with the Karsten group to do our HR. And for us here at the hospital, seems to be going well. Kelly, would you agree that that's been a good choice?
Yeah.
Yeah. So Kiki and Emily have been working on, Emily is the gal from HR, from Karsten, have been working on getting all the files in place. And Chris, how did that go with survey? Did we have any issues? Did they find anything on survey?
With HR? No, nothing that we weren't already prepared for.
Okay, awesome. Very good. As far as the IT report, obviously still things going on with all of this stuff from Russia, and Mark has been blocking those IPs, anything coming from Russia. So far so good, right? Along the IT line, still in talks with Duncan regarding our Meditech project, and I should have a meeting. Chris and I'll meet with Roger from Duncan hopefully this week to discuss that further. Marketing, I've been talking with Mark and Logan to try to get some more posts going out regarding marketing on social media, and so they're working on that. Surgery, Dr. Greg is doing some procedures. Dr. Hummel was here yesterday and did cataract surgery. We have a meeting scheduled. Actually, your report said May the 5th. We've changed that now to May the 9th to talk to Duncan about what they think they can offer us there. Did any of you have any questions in anything in the report that I had sent you earlier? I think after I got back, we talked about some of the stuff. BKD, Chris and I have a kickoff meeting with them scheduled next week, I believe, next Wednesday or so. So nothing's really happened on that. True Bridge-wise, hold on to your seats. We think it is getting a little better. In fact, they asked us if we wanted to switch teams yesterday, and after Chris talked to staff, they want to hold off on switching. They think that Sharon, the new manager oversight that's come in, is doing a good job. So we won't hold our breath, but hopefully that will continue in a positive direction. Other than that, the DMV survey went well. So 365 days in a year. My vacation was scheduled for 9 months or 10 months, and they choose my first day of vacation to come and do their, actually it was a virtual survey. So, but it went well. There was about 6 items that needed attention, but nothing big, and kind of had to dig for those, so I was pleasantly pleased with that. That's all I have. That seems kind of boring, doesn't it?
We still have the surgeon group coming.
Yes, that's Duncan. North Star.
Or-
Oh, yes,
Oh,
tomorrow.
Next
Is that
time.
tomorrow?
May
Oh,
4th.
it's next
May
week.
4th.
Yes, yes, we do.
Have you gone there?
In Reach.
Yes, May 4th.
Yes,
Yeah, still good on that. That's next week.
yes. Next Wednesday. Next Wednesday at noon, and then again at 3,
3:30.
3:30.
Okay.
Send us our times.
or 3:30. So we need to make sure what time, if you'll
Yeah.
make sure you get with Rosemary, make sure that we don't have too many at one meeting, so that we're not having a, whatever you call it, an illegal meeting.
I've got 3 on each, and Greg wasn't going to be able to make it, so
Okay.
that worked out perfectly.
Noon, right, noon?
What?
Noon?
Exactly.
Okay.
Sweet shirt. And that day,
By noon.
Dr. Brown and Dr. Hannah.
Anybody, hi Dr. Bird?
Okay, any other questions for Candace? If not, Candace, thank you. Oh, wait, actually, I'll need a motion, I guess.
I move to approve the CEO's report as presented.
Second.
I have a motion by Dr. Brown, a second by Dr. Simon to approve the Share Medical Center written report for April 26, 2022. Roll call vote, please.
Hannaford,
Yes.
Burke,
Yes.
Simon,
Yes.
Brown,
Yes.
Bowman,
Yes.
Casper.
Yes. Now, Candace, thank you. CFO's report, Chris?
Okay, first page, you can see that our cash balance for the end of March was up from the prior month. We did receive our cost report settlement in March. It was supposed to be about $550,000 with our Medicare advance loan that we had. We ended up getting about $380,000 of that back. With them taking out the $180,000, we are now paid up for our Medicare advance loan, so we don't, everything that comes in from Medicare, we're now getting 100%. We're not having anything taken off the top of that anymore. So that is a very good thing. And I think we've been able to notice that in the last, in the first part of April, and you can kind of tell that Medicare, when it comes in, that it looks more like it should. So it's nice to have that done and not have to worry about it anymore. We had a decrease in our AR. I told you at the last meeting that I would add a KPI, which is kind of an indicator of where we should be or where they'd like us to be. So you can see on the unbilled days, we're at 19.7 in March. Ideally, you'd like to be around 6, 7. Our billed days are 97. Typically, like that around 55. So you can tell that we're not anywhere near where we should be. But like Candace mentioned with our BKD meeting, with that ramping up in the next week, we're hoping that we'll start to see at least get some answers of what's going on with our AR. They're going to be on site. I think that was next week that they'll be on site, or in a couple weeks they'll be on site, so they can really get in and get in the weeds with everybody and ask whatever questions they have. So I'm excited to hear what they can do for us and hopefully get us some answers. You can see the outpatient revenue was higher than last month. Inpatient was down, which you can tell by the days. 62 days in March compared to 122 in February, so we cut those in half in March. Clinic visits went up a little bit. We also had a few more ER visits than we did in February too, so that's where you can see that, the difference in the revenue. Our bad debt went up, our contractuals went up. That's something that along with BKD, I'm hoping we can wrangle in. every month it just seems like it fluctuates too much. I don't really like to see that it's moving around. I think this month we had it at 54%. If you look at last month's, I think it was around 47% for our contractual. So I don't like seeing it moving around that much. I'd like to see a little bit more. We have an expectation of what it should be, so that each month we have an idea of what those contractuals will look like. Salaries went up a little bit from February. Obviously we had a few more days in March, but we also had some bonuses for providers that they hit their markers to get some bonuses, so that's why that was so much more than last month. The other operating revenue number, $2 million. That is our cost report settlement that I mentioned, and we also got our second PPP loan was forgiven in March, so that it was $1.4 million went from being what looked like a payable to now revenue that we have, or income that we have on our books. So we're glad to have that. That'll be helpful in the future. Sales tax, a little bit low this month. Sales tax every month, if anybody were to ask me for an estimate on our sales tax, typically it's going to be around $100,000, maybe a little bit more, and that's about where it is. We're at 98 this month, 103 last month, 111 in January. You can kind of see in the months when there's a lot going on. So January was higher. You also had a lot of December, so Christmas, everything happening. So a lot of times when you have those big holidays, you can see that sales tax ramp up a little bit. I also added in the last page is our 340B revenue. And if anybody is not familiar with that, a 340B it's a program that we use with the pollers right now. We're working on getting the program up and running with Walmart as well. It's just a way that we can work with holders and the contracts that they have, and the contracts we have with the wholesalers to just get some money back. You can see from July through October, there are no numbers. We were waiting on our RHC, the Rural Health Clinic, to have a CMS number tied to it. We knew that they were, we had to go ahead that we would have an RHC, but we were waiting for the number. And that is where the 340B comes into play, just at the RHC, not anywhere else in the hospital. That's how that program works. So November, we got the CMS number, we were able to turn it back on. We're in the process of still going back to recoup everything that we lost. We shut the program down in September of 20, waiting to get the RHC up and going. We weren't able to turn that back on until November of 21. So 14 months worth that we had that shut down. So we're still in the process of getting with our 340B company to make sure we're getting all the money that we should be getting back.
And the reason that took so long was because of COVID.
Yes.
And they were all working from home, so it wasn't being processed.
Yeah, that wasn't anything on the hospital side. I think we had everything turned in, and it was we were asking. TrueBridge was asking. Everybody was hounding CMS to figure out when we'd get this number. Even though we knew we were approved, we didn't have a number to attach to it. So.
But we recouped all that. There's nothing lost, right?
Right.
Okay.
You guys have any questions on anything else?
Any of that money been recouped yet? Is that part of the December and the March?
I think we've gotten some. That's where there's a little bit of, it's a little murky right now. We had the lead person that we had with Farm Force, who also helps us run this program. We lost our person. They transitioned into another role. So we have a new person who, right in the middle of all of this transition is when we got our number. So we're trying to make sure that them and our previous person are on the same page, and we're going back. And I think it's about, we just had a call yesterday where we're giving the days to make sure that they're going back to get everything we should get. Anybody else have anything? Okay, we'll move to the convalescent. Their balance in March was 297,000. They're doing pretty well over there. ARs decreasing in each month. Their AR's been going down, which on their side, we know they've been collecting a little bit more each month. Doing a good job on their collections. Their revenue went up from February, which you can see their patient days, almost 1,200. In February it was a little over 1,000. So, let's see, salaries about right at what they were in February. $5,000 difference. They ended up coming out on top, 22,000. Which is good for them. We were a little worried at first, but when we looked into the point-click care program, we found that there was some revenue that was missing, but we were able to take care of that and figure out what happened. So their expenses, month to month, like I said, do a pretty good job. They had a big month in December, but outside of that, 275, 280,000 is about right where they've been staying. Them and the Homestead are pretty consistent. I think they've done a good job in keeping it consistent, so they have an idea of what's going on from month to month, which is really good. And their contractuals are, just like the last meeting, when I say contractual on the hospital side, it's money that is not seen. However, on the nursing home side, they're actually getting paid more than what their rates are. So, not a bad problem to have. Any questions over the nursing home? If you look back at their year-to-year comparison, not quite as good a shape as they were in 21, but still in good shape. Also in 21, anytime you look at 21's numbers, you know you're going to have some COVID dollars that went into that, which kind of inflate their numbers. So I think they're sitting in a pretty good spot. And all of their COVID money, they still get supplemental payments from OHCA that they get every quarter on their Medicaid days, which has been really helpful. I think this quarter is about $65,000 that's coming in. So they're still getting that. I don't know how long that'll go on for. If Killing does that.
I think it's going to go on as long as the public health emergency is still in effect.
So that's anybody have anything for the nursing homes? Okay, we'll move into the Homestead. Revenue, their meal revenue went up, doubled from February, so that kind of helped. Their inpatient revenue was down a little bit, which kept them about right on track from February. Salaries, right in line. Their operating expenses, just like the nursing home, their expenses every month are typically around $47,000, $45,000. So they're right there with that. Come out on top for $8,600. Their year to date is a little less than what they were in 21, but I think they're doing okay with they've got a good handle on their expenses, and they have a new manager that's working more over there. And that how it works with Karen. Karen's been more over on the nursing home side.
Tambra has been more consistently over at the Homestead Cafe, and that's the cafe over there. That's the highest cost center with personnel and supplies. So,
and I think Karen's really liked it. I think it's helped her out a lot. So, any issues with the Homestead? Okay, that's about all I have.
Any other questions for Chris? Not Chris, thank you. Next is the medical staff committee. Dr. Burke.
So we had a brief meeting on April 13th, and we kept it kind of short because we had a board meeting right afterwards, right?
Yeah.
So we kind of kept it short and sweet. About the only, oh, I guess we need to go back and do the minutes, don't we?
No.
No, agenda and minutes review, we don't need anything on that?
No.
Okay. So the only business we did was reappointment to courtesy staff of Brian Robinson. He's a doctor with Sound Physicians, which is the hospitalist group that does St. Anthony and also helps to do the telemedicine for inpatient hospital. And this is a doctor that is a fill-in doctor if our regular hospitalist is sick or out of town or whatever. And it's a reappointment. And so I'll entertain some motions regarding Brian Robertson. If you have any questions?
I'll make a motion to reappoint to courtesy staff Brian Robinson, MD.
Second.
I have a motion by Dr. Hannaford, a second by Dr. Brown, to reappoint to courtesy staff Brian Robinson, MD. Roll call vote, please.
Burke,
Yes.
Simon.
Yes.
Brown,
Yes.
Bowman,
Yes.
Casper,
Yes.
Hannaford.
Yes.
Okay.
That's all I have.
All right, man. Thank you. Next is Quappy.
Chris, you want to do that since you were? Or I'll do it. I was thinking, looking at that stuff, but I was not here. So I was thinking that last one. Really the focus, what we've been working on is with SQSS. If you'll remember, SQSS is our quality system that helps us wrap our arms around everything related to quality for our patients. And we have that system for about 5 years, I would say. And we are well on our way to learning, all the ins and outs of how that system can help us in our day-to-day. One of the things that we're starting to use it for that we have not in the past, we've used it, we had another software system called, what was our maintenance one?
Oh, facility due.
Facility due. Instead of using facility due now, we're putting all of our requests for maintenance and IT into SQSS, and that helps us keep it all in one system and make sure that we're keeping up with everything that we need to. I love it. We've started recently using it instead of saying, me passing Clark in the hall and say, hey Clark, I need you to do this. If I need Clark to do something, I put it on SQSS so that he's not distracted and forgets, doesn't fall through the cracks. But then if Clark forgets to get on SQSS and doesn't take care of the issue and resolve it, then I get a notification. I choose how long I'm going to give Clark to do it. It may be a week. And that week rolls around and it's not been dealt with, it sends me an email and it sends Clark an email that he's got an unresolved issue, but then yet I know that he's not seen it yet or not resolved it yet. So that's kind of a new way that we've been using it, and it seems to be working well. But honestly, the SQSS is the reason why we do so well at survey anymore. It really does help keep employees on task with the thousands of things that they deal with on a regular basis. So that's, in a nutshell, what we have been working with in Quappy, just to stay on top of all of that.
Okay. So then, medical records.
Medical records? Are we going to talk about medical records?
No, we didn't have any to review. We have a contract review under patient care.
Yeah, contract review.
There are 5 tasks, and looks like 4 of the 5 were 100%, and then the PCBS, reducing, this is not active.
We're no longer using
No longer
CBS.
using it.
Okay,
Should be archived.
so everything is good on that. Okay. So the next, we have a discussion to action, approve or disapprove the revisions report dated March 31st, 2022. There was no red flags on this. Everything was either included in the review or there was not included in the review, but everything passed, correct?
Correct.
Okay, so we need to approve that.
I make a motion to approve the revisions report dated March 31st, 2022.
Second.
I have a motion by Dr. Brown, a second by Dr. Simon to approve the revisions report dated March 31st, 2022. Roll call vote, please.
Simon?
Yes.
Brown?
Yes.
Bowman?
Yes.
Casper?
Yes.
Hannaford?
Yes.
Ford?
Yes.
The next item is the quality management plan for 2022. Anything you want to elaborate on that? No.
They went through it. It's a recent, I think it's new. If my memory serves me correctly, we had to go through and create a new one. This one we went to look for, we lost Lori. We could not find a quality management plan, so we had to create a new one right for survey, so
Okay.
that's what that is.
Make a motion to approve the quality management plan for 2022.
Second.
We had a motion by Dr. Brown, a second by Mr. Bowman to approve the quality management plan for 2022. Roll call vote, please.
Brown?
Yes.
Bowman?
Yes.
Casper?
Yes.
Hannaford?
Yes.
Bird?
Yes.
Simon?
Yes.
I want to say real quick, this is bringing flashbacks of getting ready for survey. And another thing that we're using, the SQSS system, we subscribe to their policy procedure management module. And I can't tell you how many hours we wasted because we could not find, for instance, this. All of those things are now in SQSS, so we won't have that problem again. New policies and all of our policies and procedures are in SQSS. Our management plans, like one of them that we couldn't find was our water management issues. And so, yeah, we won't have that problem again.
Okay. All right, next item then is the shared convalescent home report. Kelly?
Well, I'll pick up where Candace left off, because we've recently, at the nursing home, started using SQSS, and it's, we're, honestly pretty rapidly getting, tasks centered in there for our staff to stay on top of, and using it quite effectively, I think, for our maintenance work orders, IT work orders, all of those things, and it's really been a great system. I wish I'd had experience with earlier. I would have implemented it a lot sooner. But it's going well. The piece that we don't have that I'm quickly realizing we probably need to add it is a policy and procedures piece, and so we'll probably be getting with Darlene's group and finding out what our costs are going to be, so we can get a purchase order done and get that added to our SQSS. But things are, like Chris said, things are kind of rocking right along. Our census, it's kind of leveled out a little bit. It's still a little bit low for where we'd like to be. We'd like to be around 40. A couple months ago, we were at a spot where we had just over 40, and we were turning people away. And then, right after, seemed like we turned away, 5 or 6 residents, and we, had some people, wrap up their stay either as a short-term resident or pass away. And so we've been around 37 for a little while. We got as low as 32, 33, somewhere in there. So our census really isn't exactly where we'd like it to be, but the good thing is we do a pretty good job of managing our expenses in terms of how many patient days we have. We can pretty well say that if our patient days decrease, so are all our expenses, kind of in a similar fashion. So that helps. This week, well, the last couple weeks, the Leading Age of Oklahoma has been putting on a weekly webinar series on getting prepared for survey. And so we are being told that we will not have a virtual survey. We're going to have people on site, and they're going to be probably, it sounds like they're finding all kinds of stuff all over the place in other homes. And so we're trying to be as prepared as we can. This week we talked about our disaster preparedness, and while I think we're prepared, and we've certainly had our share of disasters the last couple of years, we've got some policy things that we need to make sure that we're up to speed on, and some training that we need to do with our staff. So we're getting those things put in SQSS so that we stay on top of it. Our quality measures, I have been working with the folks at Leading Age also with that, because we feel like our quality measures are improving. We're still not seeing that outcome in our national reporting. So we're trying to figure out where our discrepancies are there. On that note, we have, let's see, back in the end of November, 1st of December, our MDS coordinator took another position somewhere in town, and since that time, our DON, Tierney there, has been performing those responsibilities in addition to our DON responsibilities while we've been trying to recruit somebody for that position. We have not had any success recruiting for that position, and so we've learned about what's called a remote MDS coordinator, and there's a company called the Polaris Group that offers a bunch of consulting services, but one of the offerings that they have is for a remote MDS coordinator. So we'll probably be going that route. What we'll get for that is the exact employee that we're looking for. It'll be an experienced RN with a resident assessment coordinator credential, and that's what we look for in that position, because that's their job is to fill out the MDS and keep our plans of care as they should be for compliance with regulations, but also where they need to be in order to ensure that we're being reimbursed at the appropriate levels. Not more than what we deserve, but what we deserve. And that our quality measures are reported accurately with Medicare, so that our star rating can go up. So the expense of the remote coordinator is going to be in the ballpark, probably a little bit less than what we would spend if we were to hire an RN ourselves with the same experience and credential. And by the time you figure in benefits, it would definitely be less. So I think it's going to be something that is going to help us out. We just got the final agreement back today. Rick's looked it over, and so we're going to go ahead and sign that agreement and move forward. But that's that matter. This week, the employees at Williams Natural Gas, I'm not sure what the company is, but their employees, their company has a kind of a give back week. It sounds like what they do, and they send their staff out to volunteer to do things in the community. And this year they called and asked if we had anything at the nursing home they could do. So this morning they scraped paint off of our trim, and they've been painting our trim, and they cleaned out our butterfly garden. So they'll be back tomorrow to do more scraping and painting, and it's been hard to find people to do some jobs like that. Either they've got too much work or they don't want to work, and I'm not sure which it is. Probably both. But to have their crew of 6 or 8 guys and gals come out and help us out, it's been really great. Getting something done for us that we would have not been able to get done as quickly and certainly not as cost effectively as what they're giving it to us for. So we bought the supplies, and they're doing the work, and they're doing a good job. I think you guys have a copy of my report. I won't read through all that for you, but Chris mentioned we're getting another supplemental payment for our Medicaid days. That's all I have for the convalescent home, unless somebody has any questions.
Any questions for Kelly?
If anybody wants to see that agreement, I have it with me.
If not, Kelly, do you want to move on to the Homestead Report?
Let's move on to the Homestead Report. Nothing out of the ordinary at the Homestead. Things are moving right along. It's weather's getting nicer, and the folks for the community garden have been, at work a little bit out there, so that's coming along. Probably the biggest thing is that we've been having some car trouble, and we've got an action item on the agenda, and I'll go ahead and I'll pass these items around. This first packet, I'll start with Bo. It's got a 2020 Chrysler Pacifica. This is at Wendy Ford, and in here is the cost of the van, along with the Kelly Blue Book and the NADA price sheets for the vehicle. It is priced at $34,600, and that is less than the retail values on either Kelly Blue Book or NADA. The issue that we're having is with our 2005 Lincoln Town Car, and I'm going to send these around as well. But that's the NADA and the Kelly Blue Book values on that. It's not worth a lot. We've been having mechanically it's sound, but it's been having trouble with things like the doors not opening, the trunk not opening, and for what we do, kind of need that. So we'll be, with these action items, we'll try to this price on the van. Well, let me tell you first. Wendy Ford and Crop both came out and brought vehicles to us so that our residents could get in and out of them and see if they were going to work and all that kind of stuff. And at the end of the day, the residents and the staff thought that the Pacifica van would be best to meet the majority of our residents' needs, and so that's what we are recommending to purchase. But I really appreciated that both the dealerships here in town took time to bring vehicles to us so we could try them out, rather than having us try to figure out how to get people there to see if they were going to work. And in that particular business, it's a big deal. So really appreciate that. Wendy's has held this vehicle waiting on board consideration. So that is my recommendation, is that we do approve the purchase of that van, and then we declare the Lincoln Town Car surplus and let me trade it off.
Do we have the funds for this?
Yes. I think we've had the Lincoln since around 2014.
How much was Wendy gonna give trade for it? Are they gonna
I
give
haven't
it?
asked him yet. I'm gonna try to give a lot.
Are you gonna do this the same that we're doing the nursing home each month, take some out, or?
That's what I figured. But what we did with the van when we bought for the nursing home, we used the money we have in our money market account and essentially financed it ourselves at 0 interest. So we'll draw down that money market account for the price of the vehicle, and we'll pay ourselves back in 12 installments.
Right.
Okay.
If any of you want the Lincoln, we'll have to do silent bid, I guess. Sealed bid.
The timeshare working on
It says a rough trade-in, does that mean
It's
rough?
I would call it mechanically sound. It wasn't too many months ago. I drove it to Ada and back.
Oh, Lord.
Just leave the windows down so you can Dukes a hazard if you need to.
Air conditioner works.
I just meant you said the door sometimes doesn't.
Oh, yeah.
You just have to crawl in from the other side.
Probably cross. It all works right now, but it may not, it's unpredictable. I'll just put it that way. We want more predictability at the homestead.
I make a motion to purchase a 2020 Chrysler Pacifica Touring LFWD van from Wendy Ford, and to put the 2005 Lincoln Town Car.
No, can't do that.
Just do one.
We got
One at a
to
time?
do one at a time.
Can't do
That's
it.
correct.
Strike the last sentence.
Why we keep you here?
I'll second the motion.
Okay.
You need
Can you restate your motion?
I make a motion to approve the purchase of a 2020 Chrysler Pacifica Touring LFWD van from Wendy Ford in Alva for the amount not to exceed $34,600.
Second.
Okay, we have a motion from Mr. Bowman, a second from Dr. Hannaford to approve the purchase of a 2020 Chrysler Pacifica Touring L front-wheel drive van, 6-passenger van from Wendy Ford in the amount of not to exceed $34,600. Roll call vote, please.
Bowman,
Yes.
Esper,
Yes.
Hannaford,
Yes.
Burke,
Yes.
Simon. Yes. Brown.
Yes.
Okay. Next item is the discussion action to approve or disapprove for declaring surplus a 2005 Lincoln Town Car.
If you guys got any questions, I'll try to answer, but I think I said everything I needed to say.
You're just gonna trade it in?
I want to see what they will give me. If it's not, $1,000, I may bet we can find $1,000 from somebody. But if it's $1,000, I'd probably take it.
Well, you just made their sell easy.
They're not going to see this by
Oh.
the time I talk to them tomorrow.
Does the motion need to stipulate how we get rid of it?
No, just the way it is, selling the sealed bid or trading.
I'll make a motion to approve declaring surplus 2005 Lincoln Town Car by selling it by sealed bid or other acceptable process, or trading to Wendy Ford.
Second.
We have a motion by Dr. Hannaford, second by Mr. Bowen, to declare surplus a 2005 Lincoln Town Car and selling by sealed bid or other acceptable process, or trading to Wendy Ford. Roll call vote, please.
Esper,
Yes.
Hannaford,
Yes.
Burke,
Yes.
Simon. Yes. Brown.
Yes.
Bowman.
Yes.
Carla's going to be so excited.
Kelly, do you have anything else?
Not for the homestead.
Okay.
Foundation, I we received 8 applications for the Alva Hospital Authority Scholarship. So today, I started distributing the packets to the board members to, see who we're going to pick for the winner. That is a minimum $500. The last couple of years they've been $1,000, and it is awarded in the student's 3rd year of college, so that they have to be enrolled in a healthcare related major area of study, and for 2 consecutive years, and then going into their 3rd year they'll get, as long as they're still enrolled in that field, they will get the scholarship at that time. I think the last year we only had one that we felt was qualified to receive the scholarship, but I think the year before that we awarded 2 $1,000 scholarships. So we may be doing that again with as many applicants as we have.
I'm not sure I understand. If they win the award, they don't get the money for 2 years?
Right. It's a junior year scholarship.
But they don't apply for it their junior year?
They apply for it in high school. And
And
Wow.
they're seniors. Just because they change majors a lot of times, and
Yeah.
you want to be sure that's what they're going to stick with.
Okay, any other questions for Kelly in regards to that? If not, Kelly, thank you. Next, the St. Anthony's report.
All right. So once again, I'm Clark Hauser. I'm going to tag team with Bridget Cosby, make sure we're have some attendance. And I work in the Rural Health Department at SSM. I'm also out at O'Keene Municipal Hospital, so I enjoy the contrast of topics and problems we solve. So just a couple things to talk about with SSM. Some growth opportunities. The Seminole Medical Center is going to join the SSM family in July. It's going to be a department of the Shawnee facility. And then some surgeons have joined the campus. There's a new Crohn's and Colitis Center, and then a Dr. Morgan has joined the bone and joint facility as a hand surgeon. So for the monthly affiliate meeting that we have, in April we provided some de-escalation training to anybody who was interested in attending that. It involved the security team at SSM St. Anthony's providing some slides and interactive presentations of plan ops and any of the affiliate network to basically talk down any potentially combative situations and escalating situations to help use techniques and words and verbal de-escalation. That was very helpful. And then in May, the education is slated for, I guess, to focus on the provider contracting, either payers or providers, so BCBS, Aetna, things like that, and Medicare compliance. So May should be an interesting meeting to attend. On the COVID front, I'm not tired of talking about it, but the COVID numbers are pretty low, still 1 or 0 at times for the inpatient admissions. We know the public health emergency has been extended, so that I think is helpful for most hospitals that I've talked to and seen in the news. And then the CDC clarified that the COVID-19 community levels, there was the recommendations did not apply to healthcare settings and still encouraged the infection control guidelines to be followed for healthcare facilities, which involve universal masking, and then some exceptions as determined by the facility.
That answered that. We were trying to figure out how the community level affected us. I didn't realize that they said it did not apply.
Yeah, it's so confusing. I can't keep up. You turn the news on for like more than a day, and like you miss out on so much of this recommendation for COVID. But yeah, they're saying that you can have allowances, for consideration for healthcare professionals and masks and things like that, low community spread, the distancing, office, stuff like that. So you can have some of that, but they're recommending this universal masking for healthcare facilities. And then the final thing really is the Midwest City is the new addition to the family of SSM, and they have begun accepting the affiliate transfers. So in the month of March, some of those affiliates were able to transfer patients to Midwest City. So that's pretty exciting to actually have another opportunity. And then the big one at the end that we're all kind of dealing with, I'm sure, is that SSM is actually realizing a loss for their month because of the increase of wages and salaries and contract workers. And so I think as the environment is right-sizing itself, some of those contract workers and salaries are on the higher to the obscene side. And so that is actually affecting the hospital operating margins and things like that. So SSM is looking at ways of reducing the expenses for salaries and ending those contract workers that may have been paid some inflated rates just to ensure staffing. So SSM is feeling it locally. As well as HCA, if you follow that, the largest for-profit in the country, posted like a smaller $1 billion profit than a normal larger $1 billion profit. But blame salaries and a lot of other facilities like OU and Integris are feeling some of that pain now. Some of that relief aid has dried up. So it's certainly an industry change as we kind of get back to where we were without all those additional programs. And that's all that I have for SSM.
I will say that my son had an ENT procedure last week at Bone and Joint. Phenomenal. They did a great job. They were so nice and so helpful. Dr. Scott was wonderful. Yeah.
And then tomorrow, I'm sorry, tomorrow is the medical staff retreat for SSM. It starts in Dallas from Wednesday through Friday. Bridget and I are attending. Bridget's attending in Cindy's absence. You haven't heard about Cindy Carmichael. She was in a terrible car crash a couple of weeks ago, and she's now been discharged. She was in patient rehab for a while, so Cindy is taking her place at the medical staff retreat. So as SSM has assumed these new facilities, they're taking all the medical staff on a retreat to Dallas. And so that'll be a networking event for SSM physicians and administrators and things like that. So.
All right. Thank you for being here.
Thanks for having me.
Yep. Next, Greg, we have a council report.
Okay. I guess it was pretty routine. We had to do some house cleaning for the city employees with the state of Oklahoma making their retirement plan. However the state wanted it adjusted. You got to do it every 6 years, is that right? It's got to be re-looked at every 6 years and refilled out. So we had some house cleaning there. We approved, had to do some cleanup on one of our water projects, say it was complete, so we could get some grant money assigned to that. The city is also doing kind of what the hospital is doing. The system's called iWorks. We've only purchased 2 programs, ordinance and I believe Waterworks or I think that's correct. Anyway, it'll tie water, street, trash. Everybody can see the same thing with this program. The city manager, whoever can see what's going on in all departments, and me as a citizen can log in. There's a huge pothole on 3rd Beach, wherever, and it automatically loads. So it sounds like it's kind of the same thing. So I thought that was
It's going to be through an app? Is it going to be through an app for
Yes.
a community member?
Yes. Then we went into executive session for some really tough action. We had to accept Mr. Cunningham's resignation as city council.
That was
And
unanimous.
we tried to figure out any way we could to not do it. They said it's not going to do any good anyway, so we accepted his resignation, and I think that was the biggest part of the meeting.
Okay. Any questions for Greg? If not, Greg, thank you. Under the chairman's report, next month, regular scheduled is May 24th. During finance today, it was discussed to see if we could move that to the 31st. So May 31st for next month's meeting. They'll be working on budget, whether we'll have it next month or whether we'll do that in June, but we will have a budget as well coming up. If there are no other items, there was no items of new business, we are adjourned.